Hi, this is Ron. This lecture will talk about rehab for medical conditions, especially for pulmonary and cardiac disease. The objective of this lecture include understanding the effect of diseases on exercises, especially if the patient has pulmonary or cardiac disease, and how to approach internal medical conditions for rehab. Again, we will use patients that have lung and heart disease as an example, how you formulate your rehab plan for those patients. And the principles of using pulmonary and cardiac rehab, and also understand the benefit, contraindications, precautions of pulmonary and cardiac rehab. So in the past, animal rehab was limited to use on musculoskeletal neurological conditions and also even post-operations. But as long as you know the principles of rehab, you can actually easily translate the rehab and be modified and applied to many other conditions, especially those conditions that affected the patient's physical health. And here are just some of the examples. Cardiovascular diseases such as mitral valve disease, heart failure, DCM and HCM. And keep in mind that when we talk about rehab, it's not about exercises. Even though we utilize exercises, you might thinking of if the patient have DCM or HCM, well, why do I need to do exercises on them? The answer is doing exercises, certain kind of exercises, especially endurance exercises, it actually has found to improve cardiovascular functions. That actually would help to improve muscle functions because the circulation in the muscles would be better. That's going to help to maintain the physical health of the patients. So not necessarily that we have to run those patients or put them walking long in the underwater treadmill, stuff like that, because eventually those patients are going to have a compromise on their circulation and breathing. So you don't want to overwork them with physical therapy. Pulmonary diseases such as LAPAR, BOS, which is the brachiocephalic obstructive airway syndrome, asthma, COPD, bronchitis, pneumonia, those are patients actually will benefit from physical therapy. Endocrine diseases such as Cushing disease, hypothyroidism, they're always causing muscle weakness and muscle atrophy. Hyperthyroidism always causing muscle spasms with muscle pain. Diabetes also causing muscle atrophy and weakness. For those endocrine diseases, for sure you need to address those problems first because that's the underlying problems. But the manifestation of the diseases would really benefit from rehabilitations. For cancer patients or patient that has a long-lasting disease that require palliative and hospice care, those patients are going to be benefit from rehab as well. We have an entire lecture talking about rehab for hospice and palliative care. So we're not going to mention that in this lecture. When the patient have illnesses or cardiovascular pulmonary diseases, it's going to have a negative impact to the body. Especially, it will reduce the muscle mass because of the reduced oxygens and circulations in the muscles. It will decrease muscle strength and endurance because patient probably just want to lie down and lack of strength or lack of stamina to go out for a walk or for exercises. They may have exercise intolerance because they have trouble changing air or breathing. They have increased stiffness, pain, inflammations, especially patient already has osteoarthritis in the first place. If they don't walk, they don't exercise, they're going to get more painful and stiff. They may have reduced mobility, increased risk of injury or morbidity. They may have a prolonged ICU or hospital stay and decreased quality of life. So most of the impact actually can be improved, controlled, or reversed with rehab. So what do you do if you're approaching a patient with medical conditions? First of all, if the patient coming in without a referral, I would definitely talk to the primary care vet first, get an authorization for them that mention that owner interested in rehab for the patient with heart disease, pulmonary disease, or other diseases to see if the primary vet would it allow you to work on the patients. Because sometimes I usually see patients refer from veterinarian, but sometimes client come to see me without referral. But I will still call the referring vet so that I can get approval from them. So when you approach the patients, have to be cautious and also have to close monitor them. First of all, we will review the medical history very in detail to make sure, like, to see what's exactly problem it is. If the patient have a bronchitis, pneumonia, then I would definitely look at the x-ray to see how bad it is. Same thing with heart disease. Prefer we look at the cardiac ultrasound results just to see how the condition looks like. And then you want to do assessment screenings, obtain baselines, mostly functional baselines, and then you prescribe your rehab. Once the patient started rehab program, then you have to monitor the outcome and to see how the patient is doing. We'll talk a little bit more about that in the next few slides. So once you assess a patient, then you need to discuss with the primary care and owner. Make sure they understand what rehab can do and what rehab cannot do based on the condition the patient has. For example, if the patient have a congested heart failure, definitely that I will not tell them, like, avoid running, jumping, excessive exercises. And the rehab program should not be training for strength or high intensity of exercises, because you know that it's going to make that congested heart failure worse. And also what owner can do and cannot do at home. So those are the things I will sit down and discuss with the owner and primary care so that we are all on the same page. And it is very important to know that the flexibility in the treatment regimen is very essential for critical care patients. What that means is you have to always be very flexible treating patients that in a critical care or have advanced diseases. So, for example, if the patient coming in, the owner mentioned about the dog coughing a little bit more, like panting a little bit more lethargic, I would not do any exercises at all that day. I would talk to the regular vet, and they may need to have a checkup by the regular vet, or even do ultrasound to see if that heart disease is getting worse or whatever it is. Same thing with the patient with kidney failure. So, and then I will get approval from regular vet, just do a quick blood work to see if it is because if the weakness or not feeling well, is that because of the progressing kidney failure or other thing. So those are things you need to be flexible about it, especially for ICU patients. If the ICU patient need oxygen in the cage, I would not perform any exercises, or I would not take a patient out just because I want to perform exercises. Okay. And the rehab regimen should not disrupt medical treatments, especially if the patient getting chemotherapy, antimicrobial, or fluid administration. I will let the vet does what they need to do, and then I will try to fit them in to do my rehab. Okay. And for chemo patient, usually I will let us work on the rehab before they get chemo. So the way that our service usually work with the oncology is the patient coming in early in the morning, they will do blood work before chemotherapy, right? So after they draw the blood, and then we will start working on them if they are doing well. And after rehab, then they will get the chemotherapy. So just try to avoid dog with vomit, urinate, or defecate after chemotherapy. A patient with invasive monitoring and diarrhea and UTI, so they may limit participation in the intensive rehab programs, but they still may benefit from manual therapy, limited exercises, acupuncture, and laser. Okay. So even though the patient's not having diarrhea, UTI, you're not able to use underwater treadmill, there's actually a lot of other things that you can do to achieve your rehab goal. There are 4 principles that when it comes to rehab for internal medicine conditions that we need to look into. First is the rehab assessment and screenings. I will talk about that in detail in the next slide. And also fit VP principles of exercises prescriptions. So you prescribe your exercises based on this principle, which we'll talk about that later as well. warm-up and cooling principles is also important. You want to warm up before exercises, and you always need to cool down after exercises. And also monitor for exertion scale as well, so which is the exertion assessment. For rehab assessment, especially if the patient has lung or heart diseases, here's what I would generally do, and try to do all of them. That's how I would approach. Candidate screenings, you need to know the disease diagnosis, severity, stage, or how stable the patient is. Do the patient have any concurrent illnesses that you need to be aware of? What is the daily activity level of the patient? Then you need to do a full PE. You need to get a resting heart rate, resting respiration rate, mucosa, CRT, body temperature, and blood pressure. You need to look at the BCS, MCS, which is stand for muscle score, condition score. Always listen to the lung, the heartbeat, and breathing pattern. So patients that have lung and heart diseases, sometimes I would obtain the oxygen level, sometimes even the arterial oxygen level, but it's not that common in animals. Radiograph, again, Holter, ECG, or cardiac ultrasounds. But those are the things usually is done by the cardiologist. So before patient, if the patient have heart disease coming to see me, if I think that I need a further diagnosis, then I will send the patient to see a cardiologist. And the cardiologist will try to figure out the oxygen saturations, the arterial oxygen saturations, Holter ECG, ultrasound, whatever they would do. And after they have the diagnosis, then we would discuss about if the patient would really benefit from rehab. That's how I would really usually approach. In human side, they actually measure your maximum heart rate and also maximum Vmax. So that's to look at the oxygens, the maximum oxygen that the patient required. This is a picture how they require those maximum heart rate and Vmax, but it is not possible in animals a lot of time. So we don't have the equipment to measure the maximum heart rate and maximum VO2 max. You also need to do a full blood work if the patient have not been already done. You need to do a full rear exam as usual. But one thing that I would add is what we call the 6-minute walking test, which we'll talk about that later. And also the exertion scales for those patients. Nutritional status is another thing that I would look into to make sure that the patient get enough nutrients, proteins, and that may affect sometimes the muscle mass and also help to prevent muscle atrophy. Now let's talk about 6-minute walk test. It is a test that's been proved or been validated through human and animal studies. What it does basically is to measure distance a dog can walk comfortably in 6 minutes. It is a functional test to assess the cardiopulmonary reserves. It is not to evaluate maximum effort, but to evaluate the activities of daily living of the patient. It also used as a predictor of morbidity and death from heart and lung disease. For example, if the dog could not walk longer than 3 minutes, then when you do the exercises, you need to be careful not doing longer exercises because it could possibly causing morbidity for the patient. Or if the patient initially have a 5-minute walk test is good, and then over time it decreased to 5 to 3 to 2, then you know that it's the heart disease or lung disease might getting worse. Okay. It is also used as a method of assessing patient response to therapeutic interventions. For example, if the dog only able to do 3 minutes as a baseline, after exercises and then after rehab for 3 weeks or 5 weeks, however long that you want to treat the patient, then the 6-minute walk test increased to 6 minutes. That would be that would tell you that the dog is responding to your rehab plan. It's a very easy way to perform, and dogs usually tolerate it very well. It has been studied in dogs with cardiopulmonary disease, obesity, and also BOS syndrome. In general, sick dogs walk a shorter distance and more slowly. They may get tired after 3 minutes, 4 minutes, but again, after rehab, if they're getting better, they can walk 6 minutes without any problem. That means that you get some improvement. These tests have been modified over the years. One study done in 2019 modified as 5 minute walk plus 3 minute trot test. It has a great sensitivity of clinical examinations for both diagnoses. So how do you do these tests? First of all, you get a baseline of heart rate, respiration rate, body temperature, and also oxygen saturations. Then you need to acclimatize the dog first. Let the dog kind of walk around for a few minutes. And after that, you walk the dog at its own pace for 6 minutes nonstop. A long and non-obstructed 53-meter long L-shaped hallway. So this is based on the study, but you can use any hallway that allows you to walk for 6 minutes. And after 3 minutes, you need to stop and measure the heart rate and also the saturations, oxygen saturations. And at the end of the walk, you measure that again along with respiration rate and body temperature. And that's how you get your baseline to see if the dog able to do the 6 minute walk or the dog having trouble finishing that walk test. The next one is the rehab exercise prescription principles, which with the mnemonic of FIT VP. So that would be frequency, intensity, time, type, volume, and progressions. Based on these prescriptions and how you want to formulate your rehab plan. So here just descriptions of each of the goal. Frequency, it's how many days per week. Intensity is, again, the percentage of physiologic maximum, either heart rate or strength. It may not be possible to measure how many percentage of the maximum heart rate the patient can do in dogs and cats, but at least that you know, intensity-wise, you need to slowly start from low intensity and slowly increase to a high intensity. Always start with low. That's how I do it for how many minutes of time you want to do, what type of exercises you want to do. Again, there's a lot of exercises that we talk about. Core strengthening, balance, proprioception, strength, endurance. Those are exercises you can always combine together to treat patients with heart and lung disease. Volume-wise, it's not that commonly used in pets just because it's hard to really prescribe the volume of the exercises, unlike in human. So in human, you can choose like 150 moderate intensity exercises, or you can choose 75 combined moderate and vigorous intensity. But it's not that easy or possible in pets, at least to my experience. Progressions, again, you need to monitor the progression of the patient. Let's say the patient can only walk 6 minutes in the first week, and then you would expect that the second week, if the dog respond to your treatments, they should be able to walk at least 10 minutes or so, or 12 minutes, okay? That's how you monitor the progression. Warming up and cooling down is very, very important, not only just for a patient with internal medicine conditions, but actually for all kind of patients, even though it's a neurological or orthopedic conditions. You need to do some sort of warm up and cooling down. So warming up, able to slightly increase the body temperature, that would cause vasodilations, and that would increase blood flow in the muscles and increase oxygen perfusions. It helps the body to gradually increase its heart rate, respiration rate, and blood pressure, and that's going to slowly increase your VO2 max. It improves performance and protect against injury. That's a main benefit of warming up. And then by doing so, You're able to stretch your muscle, tendon, ligament easier. You're also able to increase speed of contraction and relaxation of the muscles, increase sensory input, and for agility dog or sport dogs, it actually is very good for or as a rehearsal for activity, and that would help to improve their skill and coordinations. There's a two type of warm-up. One is passive warm-ups. You can do passive range of motion, bicycling, massaging, stretching. You can either utilize modalities such as heating pack, ultrasounds, or diathermy, which is commonly used in human, is not commonly used in animals. Or you can use active warm-ups, walking, trotting for a few minutes, but you should not cause any fatigue. 10 to 15 minutes warm-up should be sufficient. Especially you can use maybe like 5 minutes massaging and then 5 minutes of slow walking. Okay? It might require longer time to warm up the body in a patient that is debilitating. Now, after exercises, then you need to cool down the patient. Usually that we use a low intensity exercises such as walking to cool off the patient. It helps encourage the blood to continuously to be circulated through the body and to the muscles. And that's going to help to remove the waste product from the muscles, especially lactic acid. In humans, cooling down also helps to dissipate heat, but in animals, since the animal only dissipates heat in the tongue or panting, so it might not be beneficial for this purpose. But again, slow walking the dog actually get the air flowing. This actually would benefit dogs' breathing. Cooling down in humans have found that it could reduce risk of arrhythmias, orthostatic hypotension, and also bronchospasm. Okay. The time used for cooling down is about 10 to 20 minutes. Again, you can walk for 5 minutes at least, and then after that, you can just let the dog lying down, and you can do stretching, massage, passive range of motions until the heart rate and respiration rate slow down to the normal number. So the last one is perceived exertion scales. This usually we use that whenever a patient come to do rehab, and then we want to make sure that the exercises that you prescribe does not cause too much of exertions or causing fatigue. Okay, and this is based on a study done published in 2019 on dogs. So this is a not yet validated, but this is just what the paper recommended to look for when you want to figure out the exertion level of the patient. So if the level is 0, there's no effort noted, no sign of exertion, panting, no agitation or abnormal gait. If level is 1, the dog still should be comfortable. There may be slow showing early sign of exertion, very early panting, no to minimal agitations, no change in gait. If the patient has a level 2, that is light effort. There is moderate sign of exertion, panting consistently, but not labored breathing. Mild agitations, you should not have any change in gait. Exertion level 3 is moderate effort. There's an obvious sign of exertion, panting hard, mild labored breathing, moderate agitations, moving slow or reluctant. The highest level is level 4, which is a significant effort. The patient will be obvious sign of exertion, panting very, very hard, moderate labored breathing, moderate agitations, occasional stumbling, less than 35% of the time. So this is how you would find out the exertion level, and then to see if you need to adjust your physical therapy plan. If after the session, the level is 1 or 0, then the next session, you can add a little bit more durations, frequency, intensity. If today the patient exertion level is 3 or 4, then I probably would rest the dog a little bit longer. Or next time when the dog come in here, I would definitely would adjust the treatment plan and cut it maybe 30% of the intensity, frequency, and durations, because you don't want to extract the patient further. This section will talk about pulmonary rehabilitations. Pulmonary rehab is a program of exercise and disease management that benefit patients with pulmonary diseases. In humans, it actually is a cornerstone management for many chronic respiratory diseases. And here are just some of the examples: chronic obstructive pulmonary disease, sarcoidosis, pulmonary hypertension, interstitial lung disease, lung cancer or lung cancer surgery, lung volume reduction surgery, and lung transplantations. There's evidence have shown using rehab for those patients that help to improve quality of life, ability to exercise, and also reduce mortality as well. However, pulmonary rehab has not been really studied in pets, so we don't really have any data to prove how beneficial rehab based on scientific evidence. However, based on the human side literature, and we possibly could apply it in our pet patient too. So in normal dogs, this is what happens to lung during exercises. So when the dog is exercising, you're going to have increased muscle cell respirations. They're going to increase CO2, carbon dioxide, and then you're going to have increased ventilation and lung volume that help to increase the gas exchange. And at the same time, you're going to have increased cardiac output, which is going to give out more blood flow that carry more oxygen. And that's going to help to increase the VO2. Okay? And the better the VO2 it is, again, the better the endurance and also the strength of the patient. However, when patients have lung diseases, and there's an area that's going to be impaired of ventilation and lung volume. That's going to impair gas exchange, and eventually that's going to impair their VO2 as well. So that's going to affect or impair the physical ability of the patients. So here's some of the common dysfunctions of skeletal muscles in patients with pulmonary disease. Patient would have decreased muscle strength and endurance. They may have increased muscle fatigue. They would have reduced type 1 fibers, which are going to lose the endurance of the muscles. So hopefully you remember the differences between type 1 and type 2. So type 1, it's considered as a oxidative muscle or red muscle, right? Because they need oxygen and blood flow in order to work. This is good for endurance, like standing, walking. You need type 1 muscles. But patients that with pulmonary diseases, they tend to lose the type 1 fibers and replaced by type 2 fibers, which you can see there's an increase of type 2 fibers in those patients. Okay, and type 2 fibers is the glycolytic muscle, right? They utilize glucose to get the energy from. So it's very good for like running, sprinting, or strength. Okay. These patients also have muscle atrophy, especially you're going to see reduced cross-sectional area within the muscles. They will have decreased muscle metabolism due to reduced oxidative enzyme activity. They will have increased deconditioning and also increased blood lactate levels. Pulmonary rehab provide quite a bit of benefit for those patients with lung disease. It would help to improve respiratory functions. It stabilize or reverse systemic manifestation of pulmonary disease. It reduce complications of pulmonary disease, optimize functional status without compromising respiratory functions, increase muscle strength endurance, and also improve quality of life. When it comes to pulmonary rehab, there's two areas that I would like to talk about. The first one is called chest rehab, that we utilize positioning, inducing coughing, and manual techniques such as percussion, vibration, or shaking of the chest And that's going to help to get rid of the mucus within the trachea and bronchial. And also postural drainage, also another way that we try to prevent or get rid of those mucus within the lung. The next part we're going to talk about is exercises that utilizing manual therapy, static dynamic therapy, and modality to treat patients with pulmonary diseases. So let's start with cardiac or chest rehab. Positionings. So patients that have lung disease, ideally you want to alternate right sternal and left lateral recumbency every 4 hours. That's going to help to reduce risk of atelectasis, improve ventilations and perfusions, improve gas exchange, reduce risk of pressure sore, and minimize muscle and joint stiffness. In human medicines, doing side-to-side turnings actually have found to improve oxygenations and a reduction of post-operative fever, and thus reducing the complications or morbidity of the patient after surgery. Now, what side that you want to put the dogs on if the dog have a lung disease? Okay, so changing body positions would alter what we call the ventilation, perfusions, or VQ relationships within the lung. When the patient is on the lateral positions, the dependent lung is better ventilated than the uppermost lung because it limits the VQ mismatch. So if you're not so sure what is VQ mismatch is, then here just letting you know that the good lung should be the dependent lung, or you need to put the good lung down on when the dog is lying down, because it would make the alveolar volume smaller. The alveolar volume is smaller, it will increase the compliance of the alveoli, or the alveoli become more compliant. Then it will able to exchange more oxygens or carry more oxygens. So in the patient that have a pulmonary contusion or pneumonia, when positions patient with the bad lung down, it actually increasing the VQ mismatch, which will impair the gas exchange. What you really want to do is you want to have the good lung down. So the good lung is lying down on the floor, against the floor, because it will limiting the VQ mismatch and improving the gas exchange, and thus improving the oxygenations. Okay. So the way that I remember it is always good lung down. Okay, putting the lung that and then the bad lung it's out. Okay, either you want to how you want to memorize that, bad lung up or good lung down. So next one is coughing. So inducing coughing is very important because coughing is the defense mechanism to eliminate retained secretions. It helps to remove the secretion from the trachea to bronchi, and then you can easily cough it out. Okay. Some of the common causes of ineffective coughing, including weakness, paralysis, pain. If there's a pain, patient may not want to cough because it may cause more pain. COPD or CNS suppression, that the dog lost the reflex of coughing. Then you're gonna have more and more secretions retained in the bronchial and trachea and could possibly causing obstructions. Coughing, it's easy to induce in humans, so you just ask the patient to cough, but it is not possible in pets or animals. So the way that you could consider is kind of palpating the trachea and give a little bit like stimuli, and hopefully that it could help you to induce coughing. If the dog's not coughing, the other thing that you could consider doing is called chest percussions or coupage, which most of you have been utilizing in the patient with pneumonia. The way that we do it is performed by rhythmically striking the patient's chest wall with the cupped hands over the affected lung segment. So by doing so, you dislodge the secretion from the bronchial wall and then to the trachea and get it from the lung. sometimes we will combine with vibration. So once you coupage it and you can vibrate it, the vibration helps to move the secretions from the small airway to the larger airway and then be cleared out by coughing. Generally, you would do that for 3 to 4 minutes and then followed by vibrations. And for coupage, you can perform throughout the inspiration and expirations. For percussions, we usually don't do it on the normal lungs because there's no benefit of doing percussions on normal lungs. When you do percussions, it's very important to have a correct hand over the affected lung segments. It is more important than the amount of force you are giving. Okay, the rate of percussion should be steady. So when you do the coupage, you also need to do a circular motions over the affected lung. So what I usually do is just kind of like doing, you can see the circular motions. Okay, again, make sure that it's a correcting hand form. Okay, it doesn't have to be hard. So it is not recommended for patients that produce little to no sputum with a cough or with exacerbations of COPD. Vibrations is shaking of the chest wall that help to move the dislodged secretion towards the larger airways. Okay? You can use both hands or you can use one hand if you are using one hand to do the coupage and then vibrations. Okay? You can place on the chest over the affecting lung and then vigorously shake the chest wall. So you're going to do a coupage and then you're going to do a very, very quick vibrations. Okay, you can perform on 4 to 6 consecutive breaths following each episode of percussions. Okay. And for vibration, we only do it during exhalations because when you exhale, you easily can move that secretions towards the larger airway. So we only do it on exhalations. Shaking is very, very similar to vibration, except it consists of gentle thrust in and out rather than vibrations. So you can when you shake it, you're gonna have like thrust in and out, shake it in and out. So you're basically kind of almost shaking the whole lung segment. Okay, you can perform after the coupage or percussions, or you can perform after vibrations. Okay, and also only perform on exhalations. So the last part of the chest rehab is the postural drainage. By changing the body positions, it will allow the gravity to aid in the removal of secretions within the lung from a different lung segments. So it depends on which lung segment is affected, then you can adjust that body positions. The 3 benefit of doing the postural drainage is it prevents pooling of respiratory secretion in the lung. It enhances drainage of the peripheral of the lung. It also accelerates clearance of the mucus within the lung. Before you do the postural drainage, the main principle that you need to know is the patient should be positioned so that the segmental bronchi are vertical to the affected lung. And that's going to help to allow the movement of the secretions into the larger airway through the gravity. Okay. So for example, if this patient has a right caudal lung pneumonia, that when positioned, you want to let the dog lie on the left side and then lift up the hind end so that the bronchial or the segment of bronchi is vertical to the affected lung. The postural drainage is most effective when used in conjunction with percussions and vibrations that help to loosen up the thick airway secretions. You can adjust the positions, then you can perform your percussion and vibrations. So I'm going to go over some of the common, each of the segments that affected, how you want to position them. And this is a suggestions from Dr. Miller's book, which is the Canine Rehab and Physical Therapy. So if you want to look for more detail about how to do your postural drainage, you can refer to that rehab textbook. If the patient has the lateral segment lesions of the left caudal lung lobe, then the patient is in the right lateral position with the hind end elevated 40 degrees. Okay, again, so that the segment is perpendicular to the bronchi. If the patient have a lateral segment of the right caudal lung lobe lesions, then the patient should be lying on left lateral recumbency with the hind end elevated 40 degree. Now, if the patient have caudal dorsal lung lesions, either it is the left or right or both sides, then the patient can lie in the sternal recumbency with the hind end elevated 40 degree. Then on the opposite side, if the patient have a caudal ventral lung lesions, either left or right side, then the dog going to be lying dorsal recumbency with the hind end elevated 40 degree. Same thing with the cranial ventral lung field lesions, either left or right. The dog going to be lying dorsal recumbency, but this time it's with the front end elevated 40 degree. Same thing if the patient has cranial dorsal lung lesions, either left or right, the patient going to be sternal recumbency, but lifting the front end up 40 degree. The last one is the middle lung root lesions. The patient should be on dorsal recumbency. You can use a pillow that has been placed under the left side of the thorax so that the right side is higher than the left side. And then the hind end is elevated 40 degree and the front end is rotated to 1/4 turn to the right. So again, the idea is make sure that the lesion is perpendicular to the bronchi so that the fluid can excrete it through the gravity of the position. Now, next we're going to go through what exercises that you could do if the patient have lung disease. The few principles that you need to keep in mind: intensity, frequency, and time. For the intensity, it depends on the disease severity, and chronicity. Endurance training, usually it's easier to perform and better tolerated. So in general, comparing endurance and resistance training or endurance with strength training, you want to mostly focusing on endurance training because patient tolerate well, and it also doesn't compromise the lung functions. So because when you're doing strength exercises or resistance exercises, patient will more likely to hold breath, and that's going to cause a synchronous breathing pattern. Okay? As the patient gets better and better, ideally you want to combine both resistance and endurance trainings because you're going to see a better improvements in muscle power output and exercise capacity. Frequency and time-wise, we usually recommend 3 to 5 times a week, or each session you do 20 to 30 minutes. In human study have found that 4 weeks up to 72 weeks of rehab could help improve the mobility functions of the patients. So if you're working on dogs or cats that has lung diseases, I would probably start with 3 times a week, maybe like start with 20 minutes per sessions, and then do for 4 weeks to see how much improvement that we have. If the patient gets better after assessment, then you can always increase the frequency and time and weeks of rehab. If needed, a day of rest can be used between sessions. During the non-training day, you can just take the dog out and walking. Tell the owner to take the dog out for slow walking, and that's all. As we mentioned earlier, all exercises should include warming up and cool down periods. Warm up, you can do massage, walking for 10 to 15 minutes, or even less than that if the dog having trouble walk for that long. Patient that is debilitating, so they may take even longer for warming up. Cooling downs, walking is a good way to cool down. You can do it 5, 10, even 20 minutes and combine with massage or stretching. Again, as we mentioned, cooling down able to reduce the risk of arrhythmias, hypertension, and bronchospasm. So very benefit for patients with lung and heart disease. Therapeutic exercises wise, during the early phase, if the patient is ambulatory, exercises that I would consider is standing, walking for 5 to 10 minutes every 4 to 6 hours. If the patient needs support with sling or harness, I will make sure that the owner would use that to support them. If the dog is non-ambulatory, then I would tell the owner to do assisted standing and walking for less than 5 minutes, or as long as the pets can tolerate that. And do it every 4 to 6 hours or 2 or 3 times a day. And pet owner need to reposition them every 4 to 6 hours. I would do manual therapy, massaging, stretchings as a warm-up exercises. And after that, I would do low-intensity therapeutic exercises. Static exercises such as let the dog standing, do weight shifting, do rhythmic exercises, dynamic exercises including cavaletti, and also walk with pole, side stepping. Those are exercises considered as a low-intensity therapeutic exercises. As I mentioned, always include warming up and cooling down period. Other modality that would benefit if the patient has pain, you can always include acupuncture, laser, TENS unit. If the patient has a significant muscle atrophy, then you can utilize eSTIM or NMES. As the patient gets better and better during the early phase, then you might moving towards to maintenance phase, where you would more focusing on strength, endurance, or even combination of both. So intensity, how you increase the intensity really based on the 6-minute walking test. If the patient can do well with the 6-minute walking test, that means that the patient can tolerate longer walking or more intensity exercises. Okay, so always when you want to increase exercises, you need to balance the effectiveness and tolerance of the patient. Okay, you don't want to increase it too quick, and then the patient could not tolerate that. Okay, you want to start with moderate intensity, then maybe going a little bit higher intensity, and always you can alternate with low intensity. For example, you can do moderate intensity for one day, and then the next day you do a little bit low intensity exercises. If the patient recover well or doing well, then the next time you can do a little bit higher intensity, and then go back to low intensity just so that the dog can have enough time to recover. Okay? Interval exercises is more important than continuous exercises because you want the dog to have some break so that they can catch the breath and recover before doing the next exercise. You can perform 15 to 30 minutes per session of exercise 3 to 5 days per week. Again, must have warm-up and cool-down period. Again, you can continuously doing modality for pain control, such as acupuncture, laser, TENS unit, and eSTIM for muscle atrophy. Some of the complications for doing pulmonary rehab, including if the patient is clinically unstable, especially if they're coughing excessively, panting excessively, the gum is kind of like pale or purple, definitely that you don't want to do any exercises on those patients. Patients that have flat chest or rib fractures should not perform exercises. Patient with pneumothorax, area with open wounds, subcutaneous emphysema of the neck or thorax, or patient have a severe pain, unstable cardiovascular conditions such as pulmonary edema or congestive heart failure, and also cranial trauma or brain trauma. Those patients, you need to avoid doing exercises until they're fully recovered. This is the third section of the lectures, which we talk about cardiac rehabilitation. Cardiac rehabilitation, similar to pulmonary rehabilitation, that has become a multidisciplinary and systemic program of exercises and educations They're designed to help patients with heart disease to restore and maintain optimal health. As a matter of fact, in human medicine, cardiac rehabilitation has become a gold standard of cardiac care for patients after cardiac events or cardiac procedures. Again, in animals or veterinary medicines, we don't have data to prove how benefit cardiac rehab for patients with heart disease. But again, what we're talking today here is based on human medicine and some of my experience using rehab to treat patients with heart disease. Again, this is a slide that we mentioned earlier, that when patient is exercising, you're going to have increased muscle cell respiration, increased carbon dioxide, then increased ventilation and lung volumes. That increases gas exchange, and the heart itself play an important role here by increasing cardiac output, and that's going to help to increase the VO2 max, and the patient will be able to do the exercises very well, if not normal. So with a patient with heart disease, then you're going to affect the cardiac output and thus also affecting the VO2 max. And that's going to cause or lead to exercise intolerance or even arrhythmias, because the heart could not tolerate certain high intensity exercises. The skeletal muscle dysfunction in heart disease is very similar to the lung disease, except in heart disease, it's going to have a significant decrease in VO2 max. And of course, other things that you're going to see, including decreased muscle strength, endurance, increased muscle fatigue, reduced type 1 fibers, increased type 2 fibers, significant muscle atrophy, decreased muscle metabolisms, increased deconditioning, and also increased blood lactate levels. The benefit of cardiac rehab can be divided in two systems. One is the skeletal muscle system, where exercises can increase mitochondrial volume density. It helps to shift type 2 fibers back to type 1 fibers. As we mentioned, type 1 fibers is beneficial for endurance, for daily activities. So it's very important that patients maintain their type 1 fibers. Exercise also helps to increase capillary density and increase strength and endurance. The other system that going to benefit from rehab is the cardiopulmonary system, where rehab helps to increase the VO2 max. It also helps to enhance efficiency of ventilation, reduce lactate level during exercises, and increase or improve blood or gas diffusion across alveolar capillaries. And here's some of the benefits that have been proved in human studies. Aerobic exercises with resistant trainings help to reduce disease-related morbidity by 27% in patients with heart disease. Exercises also reduce cardiac mortality by 31%. Exercises attenuate myocardial ischemia. It reduces the risk of further cardiac events, reduce arterial thromboembolisms. It also has anti-arrhythmic effect and reduce risk of heart failure hospitalizations. So I kind of summarize the four main benefits of cardiac rehabilitation in patients with heart disease. It is anti-atherosclerotic, anti-thrombotic, anti-ischemic, and anti-arrhythmic. So when it comes to cardiac rehab, but the principle is very, very similar to pulmonary rehab. We talk about intensity, frequency, and duration. So intensity-wise, it's based on disease stability, severity, chronicity, and also owner goals as well. When it comes to heart disease, endurance exercises is usually better than strength exercises because it's utilized when it comes to strength exercises. Again, patient would require to moving fast or have a fast contraction of the muscles. that they may overuse or compromise the lung and heart functions. And we also would prefer doing interval trainings at a low to moderate intensity. And if you're not so sure about the intensity, always start with a low intensity for 1 or 2 weeks. Ideally, you can do 2 weeks and then slowly increase the intensity if the patient is doing well. Frequency-wise, we do 3 to 5 times a week. Duration-wise, you can do 10 to 30 minutes per sessions. Longer resting intervals if needed, especially if the patient start getting tired or the exertion scale is getting higher and higher, then you know that you need to have a longer resting intervals. Some patients may benefit from less frequent exercises if needed, so that they can have enough time to recover. During the day that the patient is not doing exercises or rehab, then owner can do a supplemental walking for like 10 up to like 30 minutes. There are 4 main types of exercises that can be considered when it comes to cardiac rehab. And then this is based on human medicine that I kind of translate them to canine rehab. So you can start with stretching. They're going to help to improve flexibility and ability for the joint to fully function. You can start with static exercises, which is the isometric exercises. They're going to help to improve balancing and core muscles. For example, weight shifting, these balancing, rocker board, 2-leg standing or 3-leg standing, cookie stretching, planking, or step on stairs. Those are very good static exercises. Dynamic exercises would benefit heart and lung the most, especially if you're doing dynamic aerobic exercises. For example, walking or trotting, walking on a treadmill or trotting on a treadmill, walking upstairs and downstairs, do a little bit of climbing or up the ramp, and also swimming. Dynamic resistance and strengthening would benefit improving strength and endurance of the muscles. Okay? So the way that you do the resistance and strengthening, you can either consider using elastic band that pulling the limb when the dog's walking, or you can utilize leg weights. Usually we use underwater treadmill because the resistance of the water could really help to strengthen the muscles without the dog having do too much, because walking 1 minute in the water kind of similar to walking 3 to 5 minutes on ground. So, and you actually cut down the time of walking, but you get the most strengthening exercises by using underwater treadmill. So you can do 5 repetitions for strength training, and for endurance training, you can do 8 to 15 repetitions. Again, I would usually starting with low repetitions and slowly build up the repetitions so that you don't overexert the patient. Some of the contraindications of exercises in heart disease, including a patient that clinical unstable, patient that have decompensated heart failure, Carver syndrome, patient have severe DCM-HCM, or DCM-HCM that already causing some clinical signs that you need to be very careful when doing cardiac rehab. Patient have tachypnea or dyspnea at rest or on exertion. Arterial thromboembolisms, active pericarditis or myocarditis, myocardial infarctions, uncontrolled arrhythmias or fibrillations, untreated or uncontrolled pulmonary hypertension. And here's some of the precautions, not just for the cardiac rehab, but also for the pulmonary rehab as well. So when you want to do the rehab for a patient with lung disease and heart disease, you need to do the rehab in the area that have a good ventilation. It has to be an ambient temperature, that because it could directly affect the respiratory system. Okay. For example, dog that exercise persistently in the cold, they can develop ski asthma. So if you're living in the north that during winter that you have snow, again, you want to make sure the owner not doing too much exercises outdoor where there's so cold because it can cause what we call a ski asthma. Avoid hot and humid days, especially that down south. If you want to do exercises, you might consider doing exercises early in the morning or late at night. That's gonna cooler and less humid. Or you can just do it at home without going outside. Okay, you want to avoid sudden and vigorous intensity activity. Even though the dog wants to do it, I still limited it because sometimes dogs, they just don't know what they shouldn't do. Even though they feel good, I would don't want to do too much of vigorous exercises on them. Never push to exercise beyond limits, especially in dogs with like a moderate to severe lung and cardiac disease. And always watch for breathing and fatigue sign. And also watch for sudden onset lameness or paralysis, especially for heart disease. So sometimes it might cause thromboembolisms that could cause acute lameness or paralysis. I never seen that kind of patient, but just keep in mind, patients that have cardiac disease, they do have a higher risk of getting thromboembolisms. So in summary, when it comes to rehab not only benefit for patients with musculoskeletal or neural disease. As long as you know the principle of rehab, you actually can use that for a lot of intramedullary conditions. As a matter of fact, in human medicine, rehab is the evidence-based adjunct treatment to treat humans with heart disease, lung disease, and many other internal medicine conditions as well. Rehab can maintain independence for those patients, increase exercise capacity, improve quality of life, and also reduce morbidity and mortality. Nevertheless, most patients would benefit from rehab by simply doing massage, stretching, passive range of motions, some controlled exercise regimens, or even acupuncture, laser, without really having the patient do so much exercises. And ideally, for every patient that getting rehab, we all know that there's no really one size fits all. So a patient that coming to see you, no matter what disease they have, but specifically patient with lung and or heart diseases, you need to tailor a good exercise plan for those patients. That's the end of the lecture. Thank you, and I hope you have a good day.